So I think in our practice, we really emphasize on what we call patient-centered care. And I think to me, that really means, we're treating not just the medical condition that are presented in front of us, but also, the person as a whole. And that could mean that the patient often come in with different preferences, or I think different, background that may sort of sway them to decide one surgery over another, or sometimes even decided just for conservative management, because not everything needs to be resolved by surgery sometimes. So I think having that real understanding that there's more than just a medical condition sitting in front of us as surgeons are really important. And I think that really involves a number of key components. I think one of them is having that really honest, open and detailed conversation and communication with the patient, and in the process really empowering them to understand the medical conditions, what are the the long-term natural history, what are some of the options available, and what are the different pros and cons of each of the option, because I think patient can only really make the decisions based on their own circumstances if they have a good understanding about the disease processes in the first place. And I think this is also an area that is quite unique in plastic surgery, because as I mentioned before, there's no one simple solution to each one of the problem. And so if we don't take that into consideration of the patient preferences and their social circumstances or their past history experiences, then it's very difficult to be able to offer an actual tailored solution that will be able to address their concern and ultimately give them the result that they want. So I think spending that time to listen, to formulate a plan, it's one of the key things, in these patient-centered approaches. And I think obviously, in the end, understanding, if the patient had any concerns, like giving them the opportunity to feedback and making sure that they don't feel intimidated in the process to ask questions, I think is also really important to help them to make sure that they really develop that good understanding of the disease process and what the surgery entail and the recovery processes as well.